When you're in need of medical care, the last thing you want to do is go see your doctor, who then has to send you clear across town to go see a specialist, who then has to send you to another part of town to have some tests run. What you want is to go see your doctor and get the tests and treatment you need so you can focus on getting well and being healthy. And that's why you're going to be so happy to know about the medical center we're visiting today. Hi, I'm Janice Marie with Close Up on America's Business, and we're here today in Middletown, New York, visiting Middletown Medical. Now, this is a multi-specialty physician group where you can get state-of-the-art comprehensive health care all in one location. So any doctor who's treating you has all the same information. And this isn't just an urgent care facility. It's also a place where you can see your primary care physician, your family doctor, and receive specialty care as well in an amazingly friendly and comfortable environment. So let's take a look.
Middletown Medical is a facility, state-of-the-art facility where we practice medicine, primary care, urgent care, multi-specialty, try to take care of all the needs for patient, kids, elderly, family, everybody. So everything can be done under one roof. For example, if you go to a regular physician's office and you have abdominal pain, he might send you to a lab to have a CBC done. He might send you to the hospital to get a CAT scan done. Then you come back to his office, and then he can make a decision. Oh, you've got appendicitis. Let's get you back to the hospital. So what we would like to do, you come in here, we check your white count, do the lab, check your urine, get the CAT scan done, make a diagnosis. You have appendicitis, go to the hospital. Or no, you don't have appendicitis, you can go home.
My wife and I are very, very comfortable here. We have doctors in our family, but we choose to come here because they just treat us so well. I feel that Dr. Galati, who is my internist, is a personal friend. Dr. Sisharan has so much interest in me and everything that happens to me. I have other doctors in other places, and he calls them, refers to them, and makes sure that I get the best treatment. I could not think of going any other place to have my work done, my wife's work. My mother-in-law comes here, and we've recommended at least half a dozen people to come to Middletown Medical, and they just do a really, really fine job.
I live in the community, and I would go to the mall, I would go to the shops, my family, and we'd meet people, meet patients, and say, "Doc, how's it going?" And they refer to me, this is my part of their family, this is part of their community. Oh, I go to Middletown Medical. But there's a certain pride. We have the latest and all modalities of technologies which will deliver excellent care to the patients. We have a large, latest state-of-the-art MRA. So MRA is an imaging modality. MRA is an angiogram, non-invasive way of pursuing an angiogram. CAT scans. We have echocardiography. In this endoscopy suite that we have right now, we have the ability to perform transesophageal echocardiography. We have something called T-wave testing. We have Holter monitors. This is for the heart, arrhythmia testing. Within my domain, my field of cardiology, we have everything here. So the patient doesn't feel, do I have to go to the hospital to do this particular test, nuclear stress test? I'd rather stay here. Why? Because they know me. They want me to do the test. They want us to do the test. It's a family. They know the records are on site. So I say, that's fine. We can easily accommodate. We have everything here.
When I had my surgery, I came to Dr. Sisharan, and he has been a thorough doctor. That's the reason I still stay with him. And he's really a professional doctor, I would say, because he not only takes care of your heart, he makes sure all of your medical needs are done. Anytime I have to call here for a prescription or anything, I get stat attention. I can go right to the pharmacy and pick it up. I have no problem. And also I found out that right here in Middletown Medical, my primary doctor is Dr. Kapaya, and he also keeps me intact. So I really wouldn't go anyplace else.
The philosophy we have is we want to provide the best health care possible. The way I look at my patient, they are my brothers, my sisters, so they're like family to me. You like to do the best for your family.
You are a multi-specialty practice. What types of specialists do you have on staff?
We have a multi-service, we have 3 cardiologists now, 2 pulmonologists, we have an oncologist, lung specialist, a gastroenterologist, there's a pediatrician, there are several primary practitioners, internists, rheumatologists, we have 2 rheumatologists, orthopedic surgeon, neurologist, we have an allergist as well. So we have a kind of broad spectrum that's available that people might want to access, for health care. Urgent care is always open for emergencies. The doctors are there, they have experience, they've been to work to emergency room, and so they have also that experience to provide that needed care.
My doctor basically saved my life twice as his patient. It's like going to a department store. They have everything here that you need, all the different doctors. You don't have to worry about sending out for a blood test and coming back 3-4 days later. If your doctor deems that you need a blood test right now, the blood test is done, and you just wait there for a few minutes until the results come back. It's like talking to a friend, and they're very thorough. You go in for one problem, and they'll ask a lot of questions to make sure that you don't have any other problems. So you know that when you left the doctor's office and you're going home, that everything that you could think of was covered.
One of the great things that I've seen in all the years I've been here is to watch people come in and then next I see them come in with their children, which shows the great trust that they have in our practice to be able to come in generation after generation for the care that we offer. We are an urgent care facility, but we are also a primary care facility as well as specialty care. Patients can come in when they have a bump on the head, maybe a laceration, but they can also make a relationship with our physicians for all of their healthcare needs, whether it's heart disease, diabetes, cholesterol, they can get their mammograms, any of their annual screenings, and continue, all of their healthcare needs. It offers a family atmosphere. All of our staff is asked to participate every day in what we do, and our input is appreciated. We get to contribute, and it's a variety. We really never know what's going to happen each day, so it makes it exciting.
Patients can count on the highest quality health care available to them, and that they can get everything done under one roof, and that they have caring, compassionate medical assistants, nurses, PAs, doctors to take care of their needs. And I like the fact that I always work with wonderful physicians that truly know the field of medicine and are very receptive to working with physician assistants and help me with whatever I need. The hospital is a wonderful place. A lot of times we hear from the patients that they don't like waiting in the emergency room for so long. We try to pride ourselves in the fact that we want to see our patients in urgent care within 20 minutes of arrival to the facility. So we try to get those patients from the first contact they make with the receptionist until when they're in the room with a nurse and a PA or doctor to be 20 minutes or less. That way, if somebody's having chest pain or trouble breathing or a true emergency, we can access them quickly. We may not be able to handle it here, but we can stabilize the patient, put an IV in, get them on oxygen, get some blood work going, get the process rolling, call an ambulance and send them to the emergency room so that they get the care they need right away.
The difference between interventional cardiology or cardiologist and a regular certified cardiologist is we spend at least a year, sometimes 2 years extra in training so we can perform the angiogram, the angioplasties, stents procedures. In my case, I happen to specialize also in placing pacemakers and defibrillators and a new procedure, relatively new, called a biventricular pacemakers, which we do for people with congestive heart failure. In many places it's done by electrophysiologists, and sometimes I just pop into the room and shake hands with the patients and answer the question unofficially without making a new appointment or anything like that, just because it's all within the facility.
They all care. All the staff here, they all care about the patients, and they show it. It's something that they show when they talk to you. They have that patience, and they have that love in them that they want to do something for you. I recommend, the whole staff, everybody here, to anybody who needs help. Not only medical help. They talk to you, they help you, and they're successful. They really do care about the people that they work with.
Recently, we've started doing endoscopy and colonoscopy in our office under anesthesia, and that is what we would like to proceed, to bring some surgical procedures into the office environment where we can guarantee patient good anesthesia and more smooth operation than being in the hospital setting. We have MRI, which uses state-of-the-art technology, and CAT scan is state-of-the-art technology. In the future, we would like to embrace the subspecialties of neurology, subspecialties of cardiology. Medicine is moving into subspecialty era. People don't want to see a neurologist, they want to see an MS specialist. So it's not just for patient care, it's more for the growth of our staff too. So they can grow emotionally, they can grow spiritually, and they become better human beings.
So there you have it, comprehensive health care under one roof. That's Middletown Medical. Reporting for Close Up on America's Business, I'm Janice Marie.
That concludes this edition of Close Up on America's Business. If you'd like more information about any of the companies featured on today's show, please visit our website at closeuptvnews.com. I'm Jim Masters. Thanks for joining us, and we'll see you next time.